to, but that's only going to do so much because they're all damaged, which is why I don't use them on exams anymore. Well, let's look at them in situ. Now, one of the things is you're trying to find these to study. Pretty much for these mud puppies, either the pectoral girdle is good or the pelvic girdle is good. But there's like maybe one animal in the class that both are good, which is why I got two of them here. So, let's go back to our pelvis, since we just were talking about that. And I'll put our little pectoral girdle here as well, pointing the same way. So, this is going to be shaped different than your pelvis is. Okay, not surprising. But just like I said before with us, with the kitty cat, the cartilage pointing to the front, pubis, right? Because the male is led around by his pubic region. Remember how I said you sit on your ischium? The ischium on the mud puppy looks like a pair of butt cheeks with a cartilage thong. Makes it really easy to remember. You're not recording that, right? Anyways, so here we have our little right and left ischium. Now, the cartilage running between the pubis and the ischium is a plate of cartilage called pubo-ischiatic plate. This bone here going up, well, you know what it is. The ilium. And this one got broken. Now, let me show you something that's a little different here on Mud Puppy than on you. Or at least most of you, I hope. Here's our ilium. And we've got our special rib that attaches the ilium to the vertebra. That special rib is going to be called the sacral rib. And guess what vertebra it's attaching to? Sacral vertebra, right? Make sense? We don't do that, right? Our ilium attaches directly to the sacrum. But mud puppy's different. So when you look at it here, I think that shows, yeah. You got rib, ilium. All right? All right, and again, you can see part of that here. You can again see where some of it was damaged by previous students. And then everything else is pretty straightforward. The thigh bone on our mud puppy, femur. What is a little hard is telling fibula from tibia. Because unlike mammals that have a big difference in size, they're not that different, are they? All right, well, which one's lateral on your own body? Which one's on the outside? Okay, that's too hard. Which one's in the midline? Which one's medial? You guys know this. None of you figured this out while shaving your legs. DJ, I'm surprised. So your fibula is lateral and your tibia is medial. And just like you, the mud puppy's going to have the tibia being medial and the fibula being lateral. Okay? When we get to appendicular skeleton later, we'll see that the fibula over time gets smaller because it becomes nothing more than just an anchoring point for muscle and not weight bearing anymore, at least in mammals. All right, let's look at the pectoral girdle. Again, we got a partial one here, but that one's had a few rough days. You don't have one puppy, so you might as well get it over here. Plus, just got too lazy to walk to the back of it. So again, this one, the pelvic girdle is horrible. Looks like this mud puppy owed money to the mud puppy mom. But here, we can see the pectoral girdle is pretty good. And we can see at least a partial pectoral girdle here, trying to match it up with. So, it's going to be a little different than you. Some of the stuff will be the same, but some will be different. So one thing is most of the pectoral girdle, much like most of the pelvic girdle, cartilage, not bone. We got this plate here, which we can see here. It almost looks like if you were wearing armor, the pec plate you put over your chest. That's the coracoid plate. Running cranially from it towards the head is the procoracoid. So we have our procoracoid, number 14 on the old test, number 15 was the coracoid plate. The only bone we have is right here, and it's roughly hourglass shaped, and the humerus is attaching there. So we know what bone that has to be, right? Scapula. So there's our scapula. And then there's a little piece of cartilage on top of the scapula called the suprascapular cartilage. Does that make sense? So procoracoid, coracoid, scapula, suprascapular cartilage. For your kitty cat scapula, suprascapular cartilage became the spine of the scapula, and the coracoid reduced in size as Nick knows to become the coracoid process of the scapula. Looking at the arm and forearm, of course the one bone we have here is the humerus, articulating with the scapula at what joint cavity? You know this. Glenoid. And again, just like the lower leg, the forearm is like, oh my God, I'm going to tell ulna from radius. So I want you all to knock out 100 push-ups right now. So in that position, you can have an easy time. Okay. So you'll have an easy time remembering, right? If you go in your push-up position, where's your radius? Where's your ulna? So radius will be along the midline. Ulna is lateral. But what's kind of cool when you look at this, look really closely. Think about how your radius and ulna was, or the cat. The head of the radius that's closer to the elbow was small. The one further away at the wrist was large. Whereas with the ulna, close to the elbow was big, further away was smaller. We see the same thing here. And if you look really closely, you can see the elbow cupping or being cupped by the ulna. Right there, just like on a kitty cat. But yeah, when in doubt, just do a couple of dozen push-ups to make it easier to remember. Sad thing is you think I'm joking, but they'll be on your final. Ismail's not worried. All right, does that help? Any questions?